From the very beginning of the pandemic, look, we've all been suffering, we've all been in a difficult time. Working in almost any industry is tough, but being a doctor or a nurse in these times with so many constant waves being exposed constantly to COVID, to so much sickness, is tough. They've had it tough, and it has not gotten much easier. In fact, now many nurses in a number of different states are being asked to use their sick days or vacation days for the days they're required to quarantine for the COVID that they are effectively guaranteed to get, because there's no rest from the exposure that they'll have. Nurses at hospitals in Maine, Florida, Missouri, California all said they have to use their personal paid time off if they test positive. And so they're also, some of them being told that if you test positive, but you're asymptomatic, do not use your personal time off. Don't use any time off. Come into work, because so many of you have been burned out and retired, or are sick and taking time off that are not asymptomatic, that we just need to roll the dice with people who are asymptomatic, but still potentially spreading COVID to the people that come in. I guess the only solace we should take in this horrible situation, Brett, is that the likelihood of them spreading it is low, because virtually every single person they're gonna interact with in the hospital is already going to have COVID.
I do not envy the task of being a medical professional in a time of COVID. Even if you're just seeing patients that aren't in the emergency room or people who are in the ICU, like, you're in a building where COVID is going to happen, and so people in all kinds of industries where you have to interact with a lot of folks on a daily basis, personally, physically in the same location, they're wildly fatigued. And also, a lot of them get sick, and then they articulate this to the people in charge of those businesses and those industries. And somehow, wouldn't you know it, those businesses and industries come back with things that aren't best for their employees and aren't best for their health, but are best for the industry. Best for the bottom line of someone who is sitting there in their mansion or their private jet or their personal Delta airline flight chamber. And they are able to just say, no, you guys incur the brunt of this, because I am your feudal lord and you are my serfs. Mm-hmm. That's how it all comes down. And it's sad that the money comes down to where the money's at, and frequently there's a lot of folks who are the mouthpieces of the right who are pretending that that's not the case. Mm-hmm. And that's what's wildly stupid about it. It's like when I say you should wear a mask, I'm not saying I want everyone's face to be covered at all times everywhere. I'm saying wear a mask at a time when it reduces the transmission, because 900,000 people have died. When I'm saying you should get a vaccine because it reduces, I'm not going to say because I want vaccines in everybody's system. I'm saying you should get a vaccine because it reduces hospitalization, which is going to lighten the load on people in the everywhere else. And those are real conversations. And then you see like hate lords like Jimmy Dore retweeting things that in the article he's tweeting about vaccination rates versus hospitalization rates disproves the very point he's trying to make, and proves the point that I'm trying to make, that you should get vaccinated. Because
how would you know that unless you read the article?
That's why I saw Dan Evans, Dan from the internet, tweeted like screen caps from an article Jimmy Dore shared today. And it was fantastic. It's like when you have a place where 97% of people are vaccinated and 3% of people are not vaccinated, and then hospitalization breaks down 50-50, people who are vaccinated versus people who are not vaccinated. That proves mathematically that the vaccines reduce hospitalizations.
But it requires at least just as likely minimal if it was understanding of statistics.
Yeah, and that understanding is if it was just as likely that you would be vaccinated and hospitalized as unvaccinated and then hospitalized, then if 97% of the people in the population were vaccinated, then 97% of the people in hospitals for COVID would be vaccinated. But that's not the case.
Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.